When we talk about aged care, we often picture a comfortable room, good meals, and social activities. All of these are important, of course. But there's another layer, a vital one, that sits at the very heart of well-being for older people. This is clinical care. It's the specialized health support that addresses the medical needs that often accompany aging. Think of it as the healthcare you'd expect from your GP or a hospital, but delivered right where a person lives. This care is about more than just treating illness. It's about managing chronic conditions, preventing health problems, and ultimately, ensuring the best possible quality of life for every single resident. Without good clinical care, the other aspects of aged care simply can't deliver on their promise of a safe and dignified life. The importance of this care cannot be overstated. Now, let's get specific and look at the rulebook itself. The Strengthened Aged Care Quality Standard 5 is titled Clinical Care. This standard is designed to be a comprehensive guide for providers, outlining exactly what is expected of them when it comes to the health and well-being of residents. It replaces previous, more fragmented guidelines with a single, clear, and robust framework. Think of it as a compass for clinical excellence. It points every aged care provider in the right direction, ensuring they navigate the complex waters of healthcare with a clear focus on safety, respect, and effectiveness. This standard is not just a suggestion, it is a requirement, and providers are assessed against it to ensure they are delivering the care that older Australians deserve. The first and most fundamental commitment of Standard 5 is the delivery of respectful and individualized care. This means that every person in aged care is treated as a unique individual with their own life story, values, and preferences. It's about moving beyond seeing Mr. Smith as the man in room 12 with diabetes, and instead seeing him as a retired carpenter who loves gardening, misses his wife, and wants to manage his blood sugar so he can continue to enjoy his daily walk. Imagine a resident, Mrs. Chen, who has dementia and often becomes agitated during personal care routines like showering. A one-size-fits-all approach might be to simply get the task done as quickly as possible, leading to more distress for Mrs. Chen and frustration for the staff. Staff might talk to her family and learn that Mrs. Chen always loved classical music and used to have her bath in the evening. By playing some soft Mozart and shifting her shower time to later in the day, they transform a stressful experience into a calm and dignified one. The second core commitment of Standard 5 is that clinical care must be both safe and based on the best available evidence. This is non-negotiable. Safe means that the provider must have strong systems in place to prevent harm, injury, and infection. Evidence-based practice might sound like a technical term, but it's a simple and powerful idea. It means that the clinical decisions and treatments provided are not based on outdated habits, guesswork, or what has always been done. Instead, they are based on the latest and most reliable scientific research and clinical expertise. Consider the management of dementia-related behaviors. In the past, the approach might have been to use medication to sedate a resident who was agitated. However, evidence-based practice has shown that this is often not the safest or most effective approach and can have serious side effects. The modern, evidence-based approach, as required by Standard 5, is to first try non-pharmacological strategies. A third, and incredibly important commitment within Standard 5 is a laser focus on medication safety. For many older people, managing multiple medications is a daily reality. They may be taking pills for blood pressure, diabetes, pain, and other chronic conditions. While these medications are essential for health, they also carry significant risks if not managed properly. The wrong dose, the wrong medication, or a negative interaction between two drugs can have severe consequences. Mr. Jones takes a blood thinner to prevent strokes. He is also prescribed a new anti-inflammatory drug for his arthritis by a specialist. A robust medication management system would flag that these two drugs can increase the risk of bleeding when taken together. The aged care home's nurse would then contact Mr. Jones's doctor to discuss a safer alternative. They must follow strict procedures to ensure the 5 rights of medication administration are always met. The right resident, the right drug, the right dose, the right route, such as by mouth or injection, and the right time. The fourth key commitment of Standard 5 revolves around communication. It requires that providers maintain open, honest, and regular communication with residents and their families about clinical care. This is not just about being friendly. It's about a fundamental respect for a person's right to be informed and involved in their own healthcare decisions. For example, if Mrs. Garcia has a fall, even if she isn't seriously injured, the home should contact her daughter straight away to explain what happened, what assessment was done, and what steps are being taken to prevent another fall. This proactive communication provides reassurance and shows that the provider is accountable. This commitment to transparency also applies to care planning. Residents and their families have the right to be active participants in developing and reviewing their care plans. For instance, during a care plan review, a nurse should sit down with a resident and their son to discuss progress, talk about goals, and ask for their input. Finally, open communication includes being honest when things go wrong. This is known as open disclosure. Under Standard 5, if a clinical error occurs, the provider must acknowledge it, explain what happened, apologize for the harm caused, and outline what they are doing to investigate the incident and prevent it from happening again. The implementation of Quality Standard 5 is about more than just ticking boxes. It's about fundamentally building and maintaining trust. For families, placing a loved one in aged care can be an emotional and anxious time. They are entrusting the well-being of someone they care about deeply into the hands of others. This standard provides a powerful source of reassurance. Knowing that there is a mandatory, government-enforced standard for clinical care helps to alleviate many of these fears. It gives families a concrete set of expectations they can hold the provider to, creating a sense of security and confidence. For the residents themselves, the impact on trust is even more direct. Good clinical care makes them feel safe. When pain is managed effectively, when they feel steady on their feet due to good physiotherapy, and when they know their complex health needs are being monitored by skilled professionals, they can live with less fear and anxiety. Ultimately, Standard 5 creates a culture of accountability that underpins trust. It sends a clear message to providers that excellence in clinical care is not optional. The regular audits and assessments against the standard mean that providers can't afford to become complacent, ensuring continuous improvement in clinical services. For an aged care provider, meeting Quality Standard 5 requires a comprehensive and systematic approach. It is not enough to simply hope for good outcomes. They must actively design and implement systems that ensure high-quality clinical care is delivered consistently. The first step is to establish strong clinical governance. This is the framework of rules, policies, and responsibilities that directs and controls how clinical care is managed. It involves having clear leadership, with designated senior staff, like a director of nursing, who are accountable for the quality and safety of all clinical services. A major responsibility is investing in a skilled and competent workforce. Providers must ensure they hire staff with the right qualifications, particularly registered nurses who lead clinical care. They have a duty to provide ongoing training, including updates on dementia care, wound management, medication safety, and infection control. Providers must also have robust systems for assessment and care planning. When a new resident arrives, a comprehensive set of clinical assessments must be completed to identify all their health needs, risks, and preferences. This information is used to develop a detailed, individualized care plan in partnership with the resident and their family. Finally, providers have a critical responsibility to monitor their performance and continuously improve. This means they must collect and analyze data about their clinical care. They should track rates of falls, pressure injuries, medication errors, and infections. By reviewing this data, they can identify trends, investigate causes, and implement new strategies. This cycle of monitoring, analyzing, and improving is the engine that drives quality. Choosing an aged care home is a significant decision, and understanding what to look for regarding clinical care can make all the difference. When visiting potential homes, use the principles of Standard 5 as your guide. Don't be afraid to ask direct questions. Start by asking about their clinical leadership. Ask to speak with the director of nursing and about their approach to clinical governance. A good provider will be happy to discuss this and should speak confidently about your systems. Their openness is often a good sign. Pay close attention to the way staff interact with residents. Do they seem rushed and task-oriented, or do they take time to engage with residents respectfully and kindly? Look for signs of individualized care. Are residents' rooms personalized? Ask specific what-if questions. For example, what is your process if my father has a fall? Or how do you manage medications for someone with a complex prescription list? A high-quality provider will give clear, detailed answers, demonstrating well-established, safe procedures. Request to see a de-identified care plan. This will give insight into how thorough and person-centered their planning process is. Ask for their latest quality audit report, which should be publicly available. Look for a culture of transparency and continuous improvement. By being an informed consumer, you can use Standard 5 to find an aged care home that will provide safe, respectful, and high-quality clinical care.